lot of people always ask us, why this hasn't been done before, and if there are any challenges, because working with minorities here in the U.S. or even in Europe, a lot of people when think about underrepresented or minority populations, we always think, again, countries like countries in Latin America or Africa, but there's a lot of diversity, especially in big cities in Europe or here in the U.S. And that's an opportunity that we have to be able to increase the diversity in our cohorts by including those individuals. But there are barriers, especially here in the U.S., at working with these communities, and one of them is that a lot of the times we don't see them in the big hospitals. They live far away from the big cities where a lot of the research is being done. So one of the things that I've been advocating for is that we need to bring the research to the participants instead of asking the participants to come to the research. And that will definitely help us increase this representation. And this is what we're doing in a Parkinson's Foundation initiative called PD Generation, where we are trying to give genetic results to the patients directly, including genetic counseling for these individuals. And we do a lot of things remotely. I think that's one of the things that COVID taught us, that there's a lot of things that we can do virtually without having to see the people themselves. So that's one of the ways that we can break down some of those barriers to be able to bring people that otherwise would not be able to participate in research into research. So I've been trying to encourage researchers to be aware of that and make sure that if they are in regions where there are some of these communities, to try to engage with them in any way that they can, to be able to make sure that they are represented in research, because we see this as a big problem as we head towards precision and personalized medicine, where genetic data might be used for, to decide what the best treatment might be or what your risk is for different diseases. If these individuals are not included, they're going to be left behind. And, the health disparities that are already in place with some of these communities are going to get bigger and bigger as we move forward with this, with this approach. So I think we need to make sure that now is a good time to make sure that we include this underrepresented and minority communities in our research to be able to, know more about what the risks are and be able to provide better care for them.